Hey guys, I'm Alex Knezovic, aka Dr. K, and I had some high school students that reached out to me asking about what it's like doing my job and wanted to do a little virtual job shadow. So let's see what they think. Good afternoon. My name is Alex Knezovic. I am an ophthalmologist, and I trained in Chicago for a little while. Did some more stuff here in California, and now I'm in private practice in Los Angeles. Thank you guys for having me. I'm excited to be able to chat with you and see how the day goes. I think the first thing I wanted to kind of get across is that I think this is a really awesome experience for you guys. And when I think back to when I was in high school, I don't remember getting a chance to meet with doctors, talk with doctors, people that were doing things that I wanted to do. It's very early in the road for you, and now's the time to kind of explore things, try new things, and see if you can find what's going to be your fit. So before I kind of get started, I wanted to get a little feedback from some of the people here. Why medicine? What got you guys in this Huntley Medical Academy? Why did you guys kind of move down this road already? Something I've always been interested in. Mom's a nurse. That's awesome. I like the challenge and medical things. Huge field to pick from, absolutely. Godmother's footsteps. Little sister has diabetes. Yeah, it sounds like there's a lot of kind of family influences, which is probably how it is for a lot of people. To be honest, I didn't have my parents weren't in medicine. Both my parents are college professors, but I remember my grandma always wanted to be a nurse, and it didn't really kind of work out. She grew up in Eastern Europe, and wasn't really an opportunity for her. But I remember from young age, I think family member was kind of an influence for me as well. So I think I'm kind of right there with you guys. So this is just this is a shot for me back in med school, and thought was just that things have changed a lot over the last 10 years. I've kind of been all over the place. I was in Boston for a little while, Chicago, California, and it's been a lot of work. I've tried a lot of different things, and I think I finally kind of gotten to a place where I'm doing what I want to do, and I'm able to kind of practice medicine in a way that I enjoy. If you keep at it and you keep kind of chipping away on things, you'll be able to structure your life and your profession and everything kind of to come in together nicely the way that you'd like it to. So I want to start with a story. If I think back to maybe it was like second year of medical school, I had a friend that had reached out to me and said that there's this guy who was out in Nepal for a while, and he was interesting, and maybe you get something out of it and go check it out. So I thought, okay, why not? So I went to this lunch lecture, and I remember Dr. Fielmeyer talking to us about how there's estimated 36 million people blind in the world, 12 million of those from cataracts, and showed a video of him in Nepal where he went to this kind of remote village and did surgery for like 2 days on maybe 100 people in this village, and had a video afterwards of taking the eye patches off all of these people. Everybody's crying and hugging, kissing each other, and it was like this entire village that he single-handedly was able to change what their experience was like, what they were able to do. You had all these older people who were blind from cataracts, and when you look at it from a community standpoint, it ends up being such a big impact because you have if an older family member isn't able to see, it's actually not just them who aren't able to take care of themselves, but they start pulling kids or grandkids out of school, out of the workforce, out of things in order to be able to take care of them. So when you come in and you change that autonomy, that quality of life for the one individual, it really it makes a totally different experience for not just that person, but their family and their kind of larger community. And I remember seeing this talk and just thinking like, wow, like that is incredible. Like that's what I want to do. So I did. So he actually set up a rotation for me. I remember went and talked to him afterwards, and I was like, I think this is cool. Like, how do I get involved? So he was working through an organization in this hospital called the Telganga Eye Hospital at Telganga Eye Institute, and it's a private hospital that was built in Kathmandu in Nepal. They they have really single-handedly kind of changed the world. If you look at this statistic, over the course of about 30 years or so, there's been a 50% decrease in blindness in Nepal since this eye institute was started. These people got together, they worked towards a goal, and they were actually able to achieve something that, I think if you were to look back at this, before the institute was open, I'm sure you could find a lot of people that say, that'll never happen. Like, there's no way you can do that. If you can see, what the terrain is over there, if you can just imagine, if you live in one of these villages, right? Like, access to healthcare, isn't really an option, particularly if you're blind. Like, right? Like, imagine being a blind person living in a village in these mountains. How are you going to go to the hospital to get your cataract surgery? So, in a lot of these places, the only way that any of this is going to change for these people is if you come to them. It's another world, and I think for me, it was just such an eye-opening experience to be able to see a different part of the world, a different culture. What these people were dealing with, and how a group of individuals could come together, set their mind out on a goal, and really achieve it in a high way. Okay, so a little bit of business. So wanted to kind of give example of kind of a case of how we would do things in ophthalmology. So this is kind of what one doctor talking to another doctor, how you would present something. So let's say there's a 65-year-old male worsening blurry vision in both eyes over the last year, no past ocular history, diabetes, but no retinopathy. An exam has a 2+ NS cataract in both eyes with a normal dilated exam. We take a look, and this patient has a cataract. So if we think about a normal eye, there's a lens inside the eye. And if we take a look at the kind of picture here on the left, you'll see the lens is responsible, in kind of combination of the cornea and the lens, focus the light rays on the retina. So you're able to see them. As a cataract forms, it's actually the natural lens inside of the eye starts to get cloudy. And then when it gets cloudy, it kind of scatters that light. So your vision doesn't function as well. And as it starts to kind of scatter that, it's almost like looking through like a hazy window. And initially the window becomes hazy, but sometimes, depending on how advanced the cataract is, it can become so hazy you can't see out of it at all. So our plan is going to be a cataract extraction with an intraocular lens implant. So this is a patient, it's actually one of my patients, so I just pulled a couple of the videos from surgery, and you can see here before surgery all those kind of areas, those kind of white spots. So that's that normal lens inside of the eye, and there's a cataract there, and those kind of etchings and things you can see are going to scatter light, they're going to cause glare, they're going to cause halos, there's all sorts of vision issues you can get as a result. And if we take a peek here at our lens kind of in the middle, basically we go in, we take that lens out, and then we put a new lens in, artificial lens. New lens is clear. So now your vision is back to normal. So a couple things about ophthalmology in particular. I think some of this stuff can probably be, extrapolated to other fields in medicine, but the impact is incredible. When you think about having a patient that is totally blind and then they can see the next day, there's just not a lot of things that I see in the world that are like that. You basically in one day are able to totally change a person's life, and what their experience is with the outside world. To be able to share that with people on a day-to-day basis is just really it's really special. So along the way, as you can imagine, you develop a lot of relationships with patients. You get pretty close with people. You see them a lot. They kind of start to transfer from patients to almost friends. You spend a lot of time together. So I think those bonds make work not really feel like work. It's kind of like you're getting together to catching up with old times. It's a big team effort. I think ophthalmology is a field, like a lot of things in medicine, you work together, whether, it's the ophthalmologist, we spend a lot of time in surgery, a lot of time in clinic, and ultimately, you get to know all these people, and they become friends as well. And I think that really makes the job special. And then, I know somebody had kind of mentioned in the group chat about challenges that, I think that's one of the beautiful things about medicine is that, there's always always ways to grow. There's always ways to kind of work on things, and no two cataracts are the same. No two patients are the same. It's a field that you always kind of have to be on your toes for. And they say that some of the optimal experiences are right at the border of boredom and anxiety. You always have to have some new challenges, new things that you're working towards. And it's also it's a big high tech field. There's a lot of there's lasers and surgeries and technologies that we're able to use in ophthalmology. That if you're somebody that's into tech and likes kind of high tech stuff, there's plenty of that here. And then, outside of work, I'm fortunate to have been able to kind of set up, things in California. So I've always been a big outdoors guy. I sail, I surf, spend time with family and friends. So California's been a good fit for me. While I did love Chicago, the surfing wasn't as good, but I did have an incredible time there. So, I think the other thing that I wanted to bring up is mentorship, which I hope this ends up being a little bit of like that for you guys. There's a lot of people that helped me along the way, and a lot of people that worked with me and trained me, and through the ups and downs and everything in between. And I think you guys are kind of experiencing that now, right? You have people coming to talk about what they want to do, and I hope that you guys feel free to get in touch with me, whether it's in email or messages, or and we'll kind of get a chance to chat here in a bit as well. But I can tell you that there's a lot of people that were able to change my life and change what the experience was like for me. So I think a lot of people in medicine, and I hope that that's been kind of your experience with some of the other people that have came to speak with you, that they're willing to help, to offer ideas, connections, whether it's people to go speak with. I think there's a lot of options of how mentorship can be really important to you, as it's been very important to me. How long do the artificial lenses last here? Well, so artificial lenses, it's usually kind of a lifetime thing. So every once in a while, if there's a problem with the lens, it needs to get kind of replaced. But I tell patients for the most part, when you do cataract surgery, it's a one-time deal. We take the cataract out, we put a new lens in, and you're good to go. So as far as Ray Dalio goes, so I don't know if you guys know who Ray Dalio is. He's a guy who started this big venture capital firm in New York, Bridgewater. And if you ever, if you get some downtime in quarantine, this was one of my quarantine books, and I thought it was incredible. But so he has this line about how if you work hard and creatively, you can have pretty much anything you want. You can't have everything you want. And maturity is the ability to reject good alternatives in order to pursue even better ones. If you guys are interested more about the work that they're doing in Nepal, a lot of it's through this group called the Himalayan Cataract Project, and they're at www.cureblindness.org. The two doctors who kind of started that eye institute, this guy, Dr. Tabin and Dr. Ruit, they actually wrote a book about them called Second Sons, and I actually read the book while I was in Nepal. So it was kind of a crazy experience to be reading this book, and the characters in the book were who I was like working with that day. So that was a lot of fun for me. So if you guys are interested in learning more, I think that's a great option for you. Did I get to work in surgery in those poor areas? So basically when I was in Nepal, I was still a medical student at the time. So at the time it was kind of more like assisting type of stuff. When I went in my residency in India, I was the primary surgeon. So when we had, so a lot of the patients that we were doing surgery for were patients that had come from these kind of cataract camps from poor areas of India that didn't really have means, didn't have access to care. So they had basically kind of coordinated an opportunity for us to be able to help these people. So in my stuff in India, it was, definitely, I was the primary surgeon for a couple of weeks. What's the hardest surgery you perform? In all honesty, cataract surgery it's either the easiest thing or the hardest thing you'll ever have to learn. And you find that it's one of those things that when it's going well, it goes really well. You can do a surgery in like 5 minutes. And when it's hard, it's really hard. Sometimes you know what you're getting yourself into. Sometimes it's a surprise. I did my fellowship in down at UC Irvine in corneal transplants and refractive surgery and secondary intraocular lenses. So I also do full thickness corneal transplants, partial thickness corneal transplants. So all that stuff, they all kind of have their own challenges, but it's incredible. I love it. I really do. So let's see. So biggest takeaways from international work. There's so much, I think, to be gained from leaving your, the comfort of your own home, right? From leaving your experience, leaving, you leave your family, your friends, your culture, the things that you think are necessary to make things go. And then you pack up and you go somewhere that runs totally differently. And you find that, it still runs totally fine. That's kind of been one of the biggest takeaways for me on travel, on just being open-minded to, people that think differently than me, people who do things differently than me. That's kind of been the biggest thing to take away from some of the international work, to see how much you can learn, but also how much you can offer to help people that when you have a skill set that's able to be utilized. Craziest surgery story or case that you've encountered? Oh man. A lot of what I was doing last year was treating corneal ulcers, and those were, and not always, but sometimes were patients that had been wearing their contact lenses for a month and never took them out, and they ended up with some infection, and they end up with this big crazy ulcer in their eye that we end up having to take out, and it's just a mess. You don't want to mess with that. So that's gonna be my one piece of medical kind of PSA for the day. Are eyes squishy? The kind of eyes that are closed are not too squishy. Eyes that are open get kind of squishy, so we have to close them pretty quickly, so that we don't want the eyes to be squishy. So let's see, tips on work-life stress management. Yeah, I mean, I think it's important to try to get away. You guys are kind of getting into, pursuing some of this medical stuff, I think, at a time when the culture has changed in some ways. And I think that a lot of the push has been on wellness and making sure that, you sleep right, you exercise, you get enough, you get time away from work, you're able to kind of strategize ways to do all that. So I try to do all that myself. I get pretty much 7-8 hours of sleep a night. I exercise pretty much every day. But I think, doing all those things kind of together are necessary to make sure that, you're able to take care of yourself. And, if you're running kind of an optimal condition, then I think, you're able to take care of other people, in a better way. Under pressure in practice or work, yeah. I mean, a lot of things in medicine are high pressure. I can tell you for me, I'm working with people's eyes. Every day has some pressure, and people take their eyes pretty seriously. They take their vision pretty seriously. So, I think there's definitely stresses that kind of come with the job, but you focus on the training, you take care of yourself. I think there's also a little bit of a leap of faith. This is a system that you're kind of going through, and in some ways you kind of have to trust that the system works. There's a certain amount of trust that you have to put in the training programs, that people came before you, people will come after you, and a lot of these self-doubts that we have about can I do this, should I be doing this, they start to go away in time. As far as ophthalmology, you find that there's a big shortage of doctors. I was actually just looking at the Academy, American Academy of Medicine just released a figure 130,000 physician shortage expected by 2032. So any of these fields, and I think just like medicine as a whole, I wouldn't be worried about trying to find a job. So I think if that's a career that you're concerned that you're going to get out and there's not enough work for you, there's going to be enough work for you. The baby boomers are getting older and medical problems start to pile up, and people need doctors, and the influx of doctors coming in does not match the line of the patient population coming in. I wouldn't be concerned about being able to find a job, whether it's in ophthalmology or any other kind of field in medicine. Are there interventions for astigmatism in the form of surgery that will permanently improve vision? I have astigmatism myself, and I'm wondering. So I actually had glasses pretty much most of my life, and my fellowship, I did, refractive surgery was kind of included in things. So my program director actually did my PRK, which is kind of an offshoot of LASIK, but it's very similar. And I can tell you, it's been incredible. And I think that was actually actually a lot of my motivation was that I surf, and I was in the ocean in like contact lenses, and after you see a couple infections that people come in that from wearing contact lenses in the ocean, I'm like, this is just like, so like, oh, the irony for like the corneal transplant surgeon to like get an infection in their cornea from wearing like contacts in the ocean. So it's just like, this is just like not gonna, I don't think this is a good fit. So I got refractive surgery, and it's changed my life. I mean, it's, I'm like 2015 in both eyes, and I wake up in the morning and no glasses, no contacts. You just start your day, and it's been a lot of freedom there. I hope this has been helpful for you guys. I think you guys should just think about what you want to do, and you should just go do it. And if there's anything I can do to help along the way, happy to do that for you. All right, awesome. Thank you, Bella. All right, we'll talk soon. All right, thank you for joining.